Assalamu alaikum. Good morning, everybody. My name is Dr. Teeb Alsharid. I'm a research specialist at the Public Health Research Center at New York University, Dhabi. My background is in medicine, and I'm currently pursuing my Master of Science in Public Health at King's College London. But I'm also very happy to be part of our research team that started the UAE Healthy Future Study. So my director was actually supposed to be here, and I'm presenting on his behalf. So I'll be giving a brief overview of our study and what we've achieved so far. So to start, what is the UAE Healthy Future Study? For those who don't have a health or medical background, these are all synonyms. A longitudinal prospective cohort study simply means a long-term health study. It's the first study of its kind. We're very proud that it's a pioneering study in the UAE. And thank you to Alia for explaining about all the risk factors, since my presentation is mostly on our study. So you've all had an overview of that. So the study is dedicated to unraveling the causes and risk factors associated with the common chronic diseases in the UAE, specifically the top three, cardiovascular diseases, diabetes, and obesity. So these are our important questions because heart disease is the #1 cause of death in the UAE. 1 out of 5 Emiratis is diabetic, and 65% of the UAE population is overweight or obese. As Alia also explained, of course, this is the general trend. As countries undergo economic development, they do experience an epidemiological transition. So for us, we are currently tackling the burden of non-communicable diseases, as I mentioned. So it's very important that we understand the underlying origins and risk factors for chronic diseases so that we can develop better prevention and management strategies. So why is it important to set up a cohort study in the first place? As all of you know, for example, smoking, we all know that this is associated with the development of lung cancer. So this kind of knowledge, which we consider now common or general knowledge, only comes from such sort of long-term studies. This finding actually came from a well-known study, the British Doctors Cohort Study, which started back in the middle of the last century. So as you can see, it's very important to set up these sort of research projects. And for us, of course, we're happy that it is focused on our region, since we know we must have unique lifestyle, genetic, or environmental factors that have to be explored. So our goal was to enroll 20,000 Emiratis to follow their health outcome over time. And the participation process actually took about 1 hour for each participant with the following steps. The first is to fill out a simple questionnaire on their lifestyle, health, and socioeconomic factors. It was very detailed since we're establishing our registry of sorts, and we had questions about their past medical history, their family history, also questions about their mental health and smoking status. We had physical measurements taken, specifically neck, waist, and hip circumference. And we had to collect biological samples, specifically blood, urine, and mouth rinse. Of course, after March 2020, we stopped taking the urine and the mouth rinse samples specifically. And our cohorts agreed to be recontacted, because this is the main point, that we have to follow them up for a long time. So we're very happy that they have agreed to be followed up for more questions and more assessments. As I mentioned, we are focusing on figuring out what are the health determinants that are affecting the Emirati nationals. And a challenge for longitudinal studies are, of course, participant retention, since if successful, cohorts can continue on for decades. So we are hoping that our group will still be willing to participate. Data integrity is important in every research, so we've made sure to keep up to standard from the beginning with data collection, and now with data cleaning, and hopefully in the future soon with more data analysis. And a challenge for all research, especially for a long-term study, is of course long-term funding, which hopefully won't stop us from continuing this project. So our study population, again, was targeted to Emiratis. We focused on Emiratis only and made this a national study simply because, again, a cohort study needs to continue for decades. And while it's amazing to see the melting pot of cultures in the UAE, the reality is some people might not be here in a decade or two, and they would have moved out of the country, and we must have our sample be consistent so that we can follow trends and follow the same people who joined us at the start of the study. So all Emiratis aged 18 and above were invited to join. And since we have our government partners, all health authorities, DOH, DHA, and MOHAP are our partners. So I've also requested the Emirates ID simply as a data linkage system in the future. Pregnant women and acutely ill individuals, of course, were excluded. So to explain the study timeline, 2012 and 13, the planning phase started just in talks and on paper. The pilot study was conducted around 2014 and 15 with 500 participants, and that was successful. So we moved on to the main study recruitment phase. Again, we didn't reach our target actually of 20,000, but we did reach 15,200 something participants, which is still a great number because most research actually don't manage to reach 70% of their initial target. Of course, the COVID and other issues disrupted some of our plans, and we had to extend the recruitment phase. So we just are celebrating now the end of our first phase in 2023, and now starting the first follow-up visits. They haven't started yet, but it's an ongoing process, and we hope to receive the initial participants that joined in the pilot study in 2016. So as I explained about the cohort studies, of course, that we want to keep going, hopefully inviting participants to come back every 5 years approximately. Another goal of the Public Health Research Center and the UAE Healthy Future study is that we are very proud that we've developed partnerships and collaborations with many of our partner institutions, healthcare organizations, and governmental bodies. As you can see here, we recruited from many different sites. This is also important to make sure that our population sample is representative of the UAE nationals. The study initially started in Abu Dhabi. It was actually called the Abu Dhabi Cohort Study in the beginning. I'm glad they changed the name because approaching participants and telling them, would you like to join the Abu Dhabi Cohort Study was not as effective as saying, would you like to join the UAE Healthy Future Study? Since, first of all, we're happy that we managed to include many of the Emirates and not just focus on the capital. And of course, having the term healthy future in the title made the participants understand, even from the beginning, what we're looking for and why this study is important. So in Abu Dhabi, we recruited from Health Point, from Cleveland Clinic, military hospitals. Our university partners include higher colleges of technology. Dr. Mohammed is one of our partners, actually. Thank you, Dr. HCT is one of our very important partners, and we've actually managed to go through most of their campuses across Abu Dhabi, Dubai, Sharjah, and Ras Al Khaimah. Also, the police, Abu Dhabi police and Dubai police have joined us. Blood donation centers were a very important target to recruit participants. So as you can see, we've managed to encompass people from different life settings across the UAE. And it was a very enriching experience, honestly, to go through this. Talking to the 18-year-old in the university about their project and them commenting about that they're happy there are questions about mental health as part of our survey. And then talking to the 6-year-old who's almost retiring and the police force and him asking us about how to answer the survey on an iPad, but him still be willing to help us out and volunteer their time was really rewarding to go through. So this is a very busy slide, but I always like to show this because it elaborates what I was talking about, that how important and collaborative this study really is. While the study is founded by NYU Abu Dhabi, of course, we couldn't do anything without the partnership with the health authorities, Department of Health, Dubai Health Authority, and the federal body, Ministry of Health and Prevention. And of course, these are some of our partners. Most importantly, I think we should always remember that our study participants are also partners. because without them, we couldn't do this study. So as I mentioned, we have finished the first recruitment phase in early 2023, and we're currently undergoing the data cleaning. The final number was 15,027 Emirati nationals. And we are hoping to start the follow-up process in Abu Dhabi by the end of this year, which is coming up soon. And again, we would hope for the study to continue to be successful, that we can follow up the group every 5 years. So this is just a brief about the publications that are already published. Of course, this is not from cohort study data because we haven't finished the second phase, but this is an example of the cross-sectional or prevalence studies that were already done. And what's also very nice is, again, all of these investigators are from various institutions, showcasing the collaborative effort of this project. And another thing to point out, these publications were based on the 500 that were part of our pilot. So of course, looking ahead, we're excited to see how much further we can go with the 15,000, in addition to a longer time frame, which are both going to be hopefully strengths to increase the evidence of our data. So in conclusion to my short presentation, we hope that the data collected will guide evidence-based public health policies, intervention strategies, and healthcare practices that will be tailored to the UAE's culture, social, and economic conditions. And we hope that we continue to be successful with the ultimate goal of translating findings into actionable plans to contribute to a longer and healthier life in the UAE. Okay. That's all. Thank you.